Thank you for inviting me. Blaine is an old friend and Bunny too. And thanks to them, I'm here with you all. So thank you for having me. It's nice to be here and share this evening with you. I created a few slides. I don't want to have it be all slides, but I have to try to get through those. Not and so you're welcome to jump in and ask questions at any point. Yeah, I have like a new book, The Medicine Song. So I was like, I'm trying to promote it. So I'm trying to go back to all the programs and share the ideas of the book. And so I'll jump into the talk, and then please feel free to interrupt, and then I'll try to get to questions sooner than later. Let me get to the slides. So it's working, right? So here's the talk. Is it working, Blaine? You got it? You can see spiritual healing in the psychedelic renaissance. So, the book Medicine Song as kind of like a model for what I want to share is about this psychedelic renaissance and these last 30 years, that from the first research studies that coming out of
Joe, I think the screen that we're seeing is just kind of like the preview screen, so we can see. Yeah,
screen is
you're
paused. Okay, here we go. Stop share. Okay, let me try again. Something
okay.
happened. It was like it said screen is paused. I don't know why. Here we go. How about that? Yes? Okay. The psychedelic renaissance, kicking off at UNM with DMT research or Dr. Rick Strassman, the first DEA sanctioned research to happen again, right? Since the beginning of the war on drugs. So that's from early 1990s to now was this psychedelic renaissance, this re-look at it. And then I observe and share in the book my journey, but showing how really it's like this, the research and the evidence is kind of building this argument of like, well, there's some kind of mystical component, some kind of spiritual component, holistic, transcendental component that needed to be addressed and seems to be behind. Maybe you could make the argument of what's driving, you know, people to take another look at these medicines as something that was missing, something that was lacking in the care they receive or from the paradigm they were receiving care from. Just he went over my background and my history, and here's the book by Scott Shannon. Did the foreword. He's from in Colorado. He's been part of a lot of different projects, including Prati, the Psychedelic Research and Training Institute. So this psychedelic renaissance that's seeing, for example, these medicines come into care, in the United States and elsewhere. I just was on a call with the group MindMed from Australia, and they were sharing with us that the rescheduling of MDMA and psilocybin in Australia last year in response to a lot of the US research and the way that that's kind of already becoming part of legal care there, and it's rolling out, and they're working out the accessibility. And now psilocybin whole mushrooms, right, are available for use within the medical paradigm in New Mexico. And so there's that kind of avenue opening up. Ibogaine research kind of blowing up in Texas and coming into all different places. And ketamine, its growing presence, in these different things. So we've got DMT, the spirit molecule. Rick Strassman's work from UNM came out when the book came out when I was in medical school. The research was in the 90s, so we were just hanging out, and then there it is. DMT spirit molecule really making an impact. And so then that the 90s into the 2010s of the psychedelic renaissance, and then by the 2010s we start seeing this clinical research really start to open the path. With the MDMA research with MAPS by 2011, then there are 2013, 2018. Now it's firefighters and military veterans, and just becoming this more kind of acceptable or something people are taking a much more serious look at in the mainstream. And then breakthrough therapy status for MDMA, despite it being denied by the FDA, here last year in the United States, it opened up a path. And like I told the people in MindMed in Australia, it's like, okay, I guess we dropped the ball, or whatever reason they have, the reasons they have. But you could say they dropped the ball. And now, well, they picked it up in Australia, and they picked it up in Canada, and the world's still going round. And now their research is going to come to us. Psilocybin mushrooms, which obviously has its roots and kind of deep ancestral tradition in Mexico, and Maria Sabina sharing it with Americans. in the 50s, and then the isolation of psilocybin, and then the psychedelic research with psilocybin, and now again that opening the path to whole mushroom use. Everyone thinking that the psychedelic research was going to just be all about big pharma, but it's really opening the path for whole mushroom use even within the medical system. But this last couple decades, seeing the end of life anxiety research, and now the depression research, even alcohol dependence, alcohol use, all this clinical work that has been building across this psychedelic renaissance. And now into the 2020s, what Rick Doblin calls the psychedelic 20s, seeing the breakthrough therapy status for psilocybin to get clinical trials for, FDA approved, moving into the higher phases, phase 2 in this case, publication 2022 for depression. So just the reality that this stuff is not just, we're not just talking about it, but it's really rolling out. And that ketamine, that I like to say, it has its roots in the, it's not necessarily Maria Sabina in Mexico, but it's the Harry Potter years of European alchemy and whatnot that gave rise to this laboratory exploration that eventually leads to the isolation of ketamine in 1956. And by the end of the 2000 teens, growing number of publications talking about the role of ketamine in mental health. And now multiple studies kind of exploring it on top of all the activity going out there in the wild. And there were those people that would be like, well, what's, ketamine is not a psychedelic, MDMA is not a psychedelic, or these different things, what do they have in common? How can we put them in the same? They're not serotonin 2A receptor active the same way, ibogaine, but we do see a common ground across these substances and their effect on neural networks. Here's psilocybin affecting the default mode network, but this idea of like, some people would call it the, reduction of connectivity in the network. Some people call it collapsing the networks. So seeing this collapse of the networks, and along with that, the subsequent increased neuroplasticity, this opening of a critical window period that we see with ketamine, with MDMA, with ibogaine, with psilocybin. So this is where we start seeing the commonality of these substances that are working through different receptor systems. And then another curious commonality, which is kind of the subject of why I'm here to talk to you, is the kind of things that Bill Richards, was over there with the Johns Hopkins research, was saying, as quoted in Michael Pollan's book, if you go deep enough or far out enough in consciousness, you will bump into the sacred. It's not something we generate, it's something that's out there waiting to be discovered. And this reliably happens to non-believers as well as believers. In my clinical experience, I've definitely run into this with people on ketamine, for sure, in the jungle. This is when we first opened the center in Peru, and UNM Center Espiritual, we didn't have a building. We cooked ayahuasca outside. This is ayahuasca cooking out next to the Amazon. And so, this growing body of research that's been collected over the last couple of decades, 2023, interdisciplinary projects and study beginning to look at this like, okay, what about these spiritual or existential or religious, pardon me, religious or theological components in this psychedelic assisted therapies that they are common, and that such certain experiences are clinically relevant to healthcare outcomes. This is what the evidence is demonstrating. So this treatment that's making it in to address this suffering that's not being addressed by the current paradigm is a tendency to collapse the networks and open neuroplasticity, and also open people to spiritual, existential, religious, and theological experiences that tend to be clinically relevant. So then these people, in their paper from Emory University, said, we've got to find a way to integrate this spirituality of some kind, or whatever we want to call it, into the therapy model. And they said we might need to create some kind of spiritually integrated psychotherapy. And they give advice, and this is what we're trying to do, is figure out how to elicit and make therapeutic use of the client's spiritual perspectives, and how to make ethically appropriate use of our own spiritual perspectives. And so I always say, talking to the medical programs, how will we incorporate spirituality? Well, it'll be acronyms, like everything else in medicine. it's always acronyms. So CERT. This is a place where they don't use too many acronyms. This is Niuerao down in Peru. This is a drone view. Oh, that's from the airplane. That's from the airplane flying over. This was the healing center that we were a part of that continues to function outside of Iquitos, Peru, where there's 4 ayahuasca ceremonies a week regularly, and so it's a place where there's a lot of what people would consider to be psychedelic, therapeutic experiences, which would be basically within the tradition looked at as ceremonial healing, which is really considered a spiritual practice. And so I say, well, why did working down there and living down there in the jungle, what did I see? All these people coming down. Why did they come down there? And I said, well, they came down because they found a system. Like I'm saying, something's happening in our system, but down there, they already had a system that acknowledged the emotional and spiritual dimensions of illness. And people that were stuck in their therapy and their treatment, who had already been to the doctor and the psychologist and the psychiatrist and everything else, and had enough free time and money to fly down to the jungle, they started working with these healers who really don't necessarily write anything down during the course of the process, and really is just opening up this kind of emotional dimension and the spiritual dimension. This is one of the guys cooking ayahuasca down there with the Phoenix Suns hat. I always like to show that. I didn't give him the hat, he was wearing the hat. This is Ricardo Amaringo, my teacher, Shipibo ayahuasquero. His culture, Shipibo culture, revered in Peru and the Amazon for kind of a deep ancestral tradition of working with sacred plant medicines, including ayahuasca. And so in my previous book, The Fellowship of the River, I talked about these cases that I, as a family practice doctor, was observing. These Amazonians, are able to facilitate this very significant healing in these kind of cases that were the kind of cases that I saw a lot of people struggle with in my family practice. And so I always say, well, this similar treatment, although there was different plants used in different people, but the basic paradigm was related. And so it implies a common physiology. And the common physiology was related to an emotional healing process. And that was facilitated in a spiritual context. And so, since that time when I was working and living down there, people have gone down there, academics, to study Westerners receiving healing from Shipibos at places like the Temple of the Way of Light, a healing center there in Peru, where people would kind of, I guess, my family's Colombian, I'm Colombian American. And, this attitude that, like, oh, what the Shipibos are doing, what the Amazonians are doing with ayahuasca is like, it's somehow limited to their culture. If you don't believe what they believe, if you don't think how they think, it doesn't work on you. The ceremony and the songs and the diets. But the research shows otherwise. That the Shipibo, you ask them, no, we're trying to, obviously they have, it's not perfect, their system, they don't have everything all dialed in, but they're trying to access something universal and work with that universal something to help the patient. And it does translate in many cases. So one of my friends in Tucson, Arizona, Tahona Odom native woman, Rainbow Lopez, who's a wisdom keeper and a medicine person, she says, well, like the Western approach, like the therapy, it's like the intellectual explanation of the trauma to justify the healing. It's like, okay, yeah, you deserve to be healed. You went through this thing. But ceremony creates the environment and the circumstance to affect the healing. So like this energetic considerations that there's things we can do to make it easier. Like they say, like, you have an irrigation, the water's flowing, you can dig these little troughs and help it flow a certain way and make it easier for the plants to grow. Both work together or can partially operate separately to begin the healing process. So in the Shipibo tradition, and in a lot of traditions, we see that, nature being a guide into this kind of like the metaphysical side of life, the multidimensional aspects of life, that the nature is living within that context and is aware of that context and grows and thrives in that context. And so we can learn about that. What is it to come into that kind of harmony and encourage healing? So as we follow some of the work that's coming out of the psychedelic renaissance, and this is psilocybin research on alcohol use disorder. So much focus was being put on the mystical experience, that it was just the mystical experience, that was like what happened for people. If they just had enough of a dissolution of the ego, that maybe they would quit smoking, or, the different ideas. But then they're collecting the subjective data, say, well, it wasn't just the mystical, it's like this catharsis, some kind of energetic release or emotional release. Then there's this forgiveness, self-compassion, self-love. That these were really important processes that are kind of like very traditionally in a lot of kind of spiritual practices all over the world, like helping guide people into these processes that were then being were a big part of the transformative healing that people went through. And then the further Johns Hopkins work to show that, well, if you support these mystical experiences with psilocybin with meditation or other spiritual practices, then we could even promote more enduring effects. And so looking at the ways that they said, low dose versus high dose psilocybin, with also using like a lower amount of spiritual practice or guidance versus kind of a higher, more spiritual practice, more regular meeting, more gratitude journals, more mindfulness practice with the group, and see who did better, and what did they do better on, and what is the scale, and clinically improve, but increase gratitude, increase forgiveness, increase faith. So the determinants of the enduring effects were psilocybin associated mystical type experience, so that was a factor, but also the rate of meditation and spiritual practice turns out to influence that. This is some artwork that I created for a course about the first book, Fellowship of the River, which is largely focused, not completely, but one of the focuses is this idea of psychoneuroimmunology or psychoneuroendocrine immunology, this emotional biology, emotional physiology related to trauma, related to nervous system regulation, in the idea that baggage that would live into the physical body, where the body keeps the score of this trauma in allostatic load, which is spelled wrong there, or perhaps in the epigenetics, and expresses itself through neurogenic inflammation, and which we describe as stress, wear and tear within the system, that would be kind of a physical expression of the emotional body, that according to traditional approaches like Shipibo approach, that the emotional body has a connection to the energetic side of things. And that energetic side of things that is connected into what would be described as a spiritual dimension would be a place where you could approach the patient, and that helping people go down a process of emotional healing that might involve a deeper forgiveness process, or a self-love process, or a compassion or a gratitude process, was the kind of thing, the soul healing, that people would go to a medicine person for, in tribal culture, like in the Shipibo culture. And then, more recently to the clergy, and now more recently to the psychologists. And that this forgiveness is something that has implications for our health and well-being. And that there is this kind of intersection across the secular spiritual divide when it comes to forgiveness, that psychologists are talking about it, about people forgiving themselves. And of course, the religious traditions have been talking about it for a long time. And something about some kind of heartfelt process or emotionally embodied process that people would have to go through to feel the change. Similarly, gratitude being some kind of opening to, some people would call it like a higher dimensional energy. And that there's actually the role of gratitude and spiritual well-being, that it actually would, affect the flesh. Like we say, where does the spirit touch the flesh? And so Deepak Chopra, working with my old research boss back at UCSD, Paul Mills, exploring these topics, showing that, increased gratitude was associated with all these things in these heart failure patients, including better sleep and depressed mood, less fatigue, etc., their ability to maintain cardiac function, and their inflammatory biomarkers. So just the reality of this kind of evidence-based role of these factors. And the assessment of gratitude was through this gratitude questionnaire, which is as simple as this, to link it to what's going on in their bloodstream. I'm grateful to a wide variety of people. How much do you agree with that? So I say spiritual well-being manifests in emotional health, and the PTSD research that's been so impactful with MDMA, and let's say the role of the HPA axis in a problem like PTSD, where we know that stress is going to affect things like the cortisol levels and the way the axis works, and that it would be disturbed by emotional trauma in PTSD, and that profound emotional healing would lead to improvement or perhaps normalization of the HPA axis. And then seeing subjective experience of emotional breakthrough becoming an independent indicator of long-term response to psychedelics. Did you have an emotional breakthrough during your experience? Did you have a mystical experience? Did you work through some forgiveness? Did you work through some compassion, some gratitude, self-love? Did you have an emotional breakthrough? Again, measured through a subjective questionnaire asking simple questions, but that were able to be clinically correlated to long-term improvement. And as we follow out, here's one study from Colorado, our colleague Adele France, trying to understand what was driving change across this pan-diagnostic thing with the psychedelics. We say, okay, these people were doing MDMA or they're doing psilocybin or different things, but then they improve with anxiety problems or depression problems or even eating disorder. Through statistical analysis and a range of questions, could you determine what was driving it? What was the commonality between healing somebody with an eating disorder and healing somebody with an anxiety problem and healing somebody with depression? And it turned out, according to their research, that it was a shift in emotional processing. Their emotional processing was eased. And then they said, okay, well, what do the statistics tell us about is there ever something, if that was behind all the rest and that was connected to everything that we observed or to most everything, what was driving that according to the statistics? And it was a shift in spiritual well-being, according to people's shift in this questionnaire. So as a result of psychedelic intervention, it appears to drive improvements in emotional processing, which then drive mental health symptom improvement, shifts in spiritual well-being. So here's a Mexican indigenous wisdom keeper, talks about their philosophy, said, our ancestors tell us how to live in sacred connection. For this, it's important to feel beautifully, and it's necessary to think beautifully, but it's much more significant to connect beautifully. Through that kind of connection, you remember who you are, you know who you are, and you celebrate who you are. But the idea is this connection that we're talking about is a tangible phenomenon, subjectively tangible. Just like when you ask all these questions, do you feel anxious? Do you feel depressed? Do you have nightmares? Are you sleeping well? Can you feel the connection? So the Watts connectedness scale, kind of bubbling up here at the end of this and the opening of the psychedelic 20s here, we see images of the fungus, the soil fungus that turns out, and also in the 2020s, that we learned that there's a soil fungus that produces ketamine in nature. But then meanwhile, at the same time that we were discovering that, the Watts connectedness scale emerges as another kind of indicator of long-term response to psychedelics, saying, well, as we're trying to figure out who's going to respond as we assess their experience, did they have a mystical experience? Did they have an emotional breakthrough? Did they have a shift in spiritual well-being? And now we have one more way to look at it. Did they have improved connectedness? And like I say, it's not just a theoretical concept, connectedness, no, meaning like you feel more connected to self, more connected to others, to nature, and the universe. And I think this is very interesting that this is emerging, because it really parallels some Native American concepts around right relationship that I think I found here in Arizona and down in Peru. People talking about the same idea. Now talking to some Australian colleagues at the Aborigines, also using kind of a similar framework. Like in Peru, they would say, health is about coming into right relationship with ourselves, with our intimate loved ones, our community, society, ecosystem, world, and the universe. And they would go as far to say that spirituality is actually the same thing. How we relate to the sacredness of our lives at every dimension. And so this is kind of how the connectedness scale is broken down to these different areas that they'll then use in the 19 items of the Watts connectedness scale to try to assess how is it going? Are we achieving a shift according to the subjective response? So this right relationship to me, it just keeps on showing this, like what I call, the spiritual healing element that's being illuminated by the psychedelic renaissance, or this therapy medical model, MDMA assisted therapy research, encouraging through FDA approved protocols, putting people in touch with their inner healer, with their innate healing intelligence. This is a metaphysical concept that spiritual practice and ceremony also promotes. And so this sacred ceremony, kind of what I had so much experience with in Peru, I find it very present, potentially in the work with the medicines, and it's a big opportunity as these certain experiences come up, and you try to guide people through the kind of healing that they're going to have. And so it just keeps raising the question of this sacred that we're bumping into, and its role and relationship to our physical reality. Spiritual well-being manifests in emotional health, and it affects both mental health and physical health. And that's a evidence-based statement. And so, people used to go to the medicine person, or people say the onanya, to the clergy, to the psychologist or the psychiatrist. My dad was a psychiatrist. And now they're going to the psychedelic psychotherapist, and sometimes they bring the chaplain into those, like at Emory University, to a deal with the human psyche, which I like to repeat is, although there's a misspelling on my little graphic, but, as far as I know, Greek psyche means soul. It doesn't mean mind. And so the psychedelic and the psychoneuroimmunologic, etc. So I say sacred ceremony and psychedelic assisted therapy similarly profoundly impact our emotional health and the associated physiology, strengthened by spiritual practice and secular approaches, like so-called secular approaches, like mindfulness and the gratitude journals. And these changes are facilitated by altered brain function, the neural networks, mystical experiences, emotional breakthroughs, shifts in emotional processing and spiritual well-being, and ultimately greater connectedness. Again, not just greater connectedness, it's not a mental concept, a felt experience about coming into improved spiritual well-being and emotional health. And that, I like to repeat all the time, because of my journey trying to find legal right for working with ayahuasca here in Arizona. And they said, well, Joe, you're a doctor, you're a medicine, you guys are doing healing, medical work. That's not, you shouldn't be able to get that for the DEA, religious use, because you guys are trying to heal people, therapize people. I said, well, what we're doing is spiritual healing. Yeah, I agree with you there. That's an ancestral tradition. And yeah, actually, like all the spiritual healing, for us, it's a spiritual practice. And we would go as far to say that all spiritual practice should be spiritually healing. Like that, again, is this felt, connected, tangible purpose of that. It's not just a theological argument to be had. It's like we're trying to deal with the fabric of the reality of our body and being. And so it's true that sacred ceremony and psychedelic therapies profoundly impact our emotional health and the associated physiology. So that's what I wanted to share, just to open the discussion. And some of you heard me say similar things before. Blaine's heard it before. He's heard it all before, but it's just the structure of something to share with you all. So do we have any questions or thoughts? Or I'm seeing a lot of graphics, some friendly emoticons. How do you get your hands to clap into other people's squares? It's like it's a new breakthrough. Mushrooms. Nothing? Nobody? Anything? Nothing on the chat? Okay, here we go. Angel Bryant.
So I saw on the earlier slide about the high dose and the low dose. Is there any benefits to microdosing? Where they microdose and then every few days they microdose. Is there any benefits, or is it just is the most benefits coming from the high dose?
Right. I think there are a lot of reported benefits from microdosing. Like there are those people that are microdosing, and I'm not an expert of microdosing, but they're getting more and more collecting from the community, trying to understand what people are getting from that. There is like I guess from the people that are involved in like the ceremony work or maybe the higher dose work that at some point you're like, okay, do you microdose forever or can we change the baseline? Is it possible? And that's like really the goal. And we are seeing that with the MDMA assisted psychotherapy, maybe not in every case, but wow, they really changed the baseline for those people. And having long-term response and not necessarily needing to, not that they wouldn't ever go back, but they wouldn't necessarily go back. So that's it's just the two things. One of them, and not that it's always possible, but it's opening the possibility to like, okay, is some of this maybe is chronic illness that is just not that we're not going to be able to overcome, but maybe a large percentage of it can be, overcome, and that would really like decrease the burden on our society and healthcare system.
Thank you.
You're welcome.
Hi.
Hello.
Um, I was wondering, percentage wise, like what percentage of people in your experience and in the literature seem to have a positive response to psychedelic assisted therapy? Is it like a large majority of people report enhanced well-being, or is it a smaller percentage?
Yeah, it depends on the study, right? So then, like to give an example of, I opened up by saying I was on the talking to the Australians about, MDMA research, right? So if we got to talk about like bit piece by piece, like it's just still pooling data. We don't know everything. But in the case of that study, where to get into that study, you had to have chronic treatment resistant PTSD. So that means you tried a lot of things and nothing worked. So you're not the average person. You're somebody that nothing's worked. The average duration of symptoms, from what I read on the study, was 20 years. So, okay, that's the kind of person that me as a doctor in medical school, you would just kind of, we don't have anything to help you. Like we already tried everything, it doesn't work. You've had it for 20 years. And so just non-responder, but also like outside of the scope of practice, and the minds begin to close as to the potential. So it's like severe war trauma, severe sexual abuse trauma. Like, well, that person is never going to get better. So within that study, which is the study that pushed, the United States denied, but Canada and Australia said yes, they had close to 70% of the people in the active part of the trial from that background no longer meet criteria for PTSD. So that was a dramatic response, big transformation. What about the other problems? And again, it depends on the modalities, right? So then, and how they do it. So the depression studies with psilocybin, they're definitely getting good results. Like they're outperforming antidepressants. It's a talipram, Celexa, so as far as the ethics of it, that's doing better than what people are being offered. And that's like in that case, some of those are just like 1 or 2 sessions, and maybe people would benefit from more sessions. So I think that the evidence is that we're seeing around some of those problems is at the very least, you could say much better than what is currently being offered. So that's kind of the most striking argument. So then in the case of, I asked the lady in Australia, I said, well, what happened? She's part of the organization that how did you get through to the government? Who did you get through to over there? she said, like, well, there was multiple government officials who had family members who were not improving with the current psychiatric options, right? And who had been approaching them underground, trying to ask them, can you help us get this? Can you help us get that for my mom, for my daughter, for my whatever? Meanwhile, they're so-called protecting the society, right? Protecting the society from whatever it is. And then one of the people that they had come and speak was a well-to-do person whose family member was trying to get access, with all these fighting for all these things. And right before it got passed, they killed themselves. And so this lady said, could they have been saved? So we're seeing a lot of people respond to psychedelic treatments, let's say in the veteran population, where the alternative is like when you're looking at high suicide rates, in the case of ketamine research with suicidality, yes, it's significant medical research to pull people out of suicidality with that. So I think there is some strong arguments from the evidence that maybe aren't perfect every time, but are they better than what we're doing? I think in many, many cases it is. So then the ethics, becomes a bigger issue. Now, is it more ethical? I was just talking to a friend of mine who wants to, she wants to start a new clinic, and she's a nurse practitioner. She's like, I can't take it anymore, Joe. Like, I am entering a new practice in this ethical society, right? This so-called ethical system that's trying to protect the people. And I'm a family practice doctor. I was in the system for a number of years. She's like, man, I'm getting all these old people. They're like on 30 medications. Nobody knows why and nobody knows how. And they're all like that. So it's like, we've got a long way to go if it truly interested in helping the people. Like, that's a pretty strange society where you loaded up all these old people on drugs, so many drugs, people don't even know what it is or what it's good for. The one thing is there's some people making a lot of money on it. And the other thing is just that they're stuck. And maybe of course, it makes a difference, has saved some people's lives. I know it does, but it's just excessive. And it's hard to shake that feeling. Maria. Did we lose her? Oh, there you are. But you're still muted.
Yeah, I'm so sorry. It's really hard to get to the thing on my phone. Yeah, I had a question. Thanks, Joe. It was great to hear you talk. I was wondering, what your thoughts are on, as we're kind of rolling into legal psilocybin, or at least whole mushroom in the state of New Mexico. It's going to come up pretty fast. As a Western therapy office or a Western medical practitioner's office dealing with whether it's whole mushroom or ketamine, what advice do you have for bringing in, whether it's either ceremony or even just this idea of the spiritual aspect of healing into that office? Yeah, could you speak on that?
Yeah. So I would say, kind of like I open with that from the CERT research from Emory University, where they're saying, okay, what's the beginning? The beginning, one way is like, okay, this idea of like spiritually integrated psychology. Why? Because people are going to have some strange experiences, in psilocybin and sometimes in ketamine, extraordinary, non-ordinary experiences. It will happen in your clinic and in your space. So how are you going to deal with it? How are you going to deal with that? I had my friend is running a trial, psilocybin trial at USC. And so, they're trying to keep it all very academic and sharp. And then he was on just talking to a group of people to our Patreon, I think. And so I said, well, what's the weirdest thing that's happened? He said, well, actually, this lady's dead father showed up and guided her to do this breath work that she'd never heard of before. And she did this whole breath work, and to the point of becoming like the hypercapnic, she totally had this breath work breakthrough, but was guided by the spirit of her dead father. And that ended up being like this very pivotal part of her healing process. And up to that point, they were trying to figure out how to work in this non-dual teaching into, I don't know. So anyways, the point is these things happen. So then the first step that the Emory University group thought about, I was like, okay, you want to be able to like help them deal with how that, what do they think about that? You know, are you prepared to talk to them about at least what is their belief system around? Did they talk to their deceased father? Can you talk about that? Is that okay? Do you just treat it like a hallucination? Is it nothing? What do you experience? You know, what about your own beliefs around that? And can you have an ethically kind of productive, supportive discussion? So that's the first like step. So then I would say that like for us, like our goal is to, like with our Modern Spirit, the nonprofit that we have and that's based in Arizona, and we run retreats with ketamine, and we bring a lot of like spiritual structure to it and ceremony practice based on us. So I think it has to be very personal to what you develop in yourself. So if you're a big meditator and you've gone far with that, maybe you want to bring that. You know, my friend is doing that at USC, mindfulness practice to what they're guiding the people and preparing them through mindfulness practice. And then he's had a lot of experience with that. So then he feels like he can support them through, you know, the spaces and places they may go in such a practice. Here in Arizona, we have this, you know, we'll get this nurse that has, you know, long history of working with people in all kinds of difficult circumstances. So just her clinical experience is part of the energy and the love that she brings from that. For us, that's that spirit, that ceremony. And then the other person is trained in this, like, you know, ancestral tradition, indigenous tradition ceremony. And or somebody else has this other kind of spiritual practice or some kind of development of themselves that they would bring to it. So I think it starts with that, like with viewpoints and perspectives, and then drawing upon your own experience, and then going to, like, you know, that's what we do. We're creating a setting like, hey, come experience it with us. You want to learn about ceremonial healing and the spiritual, we'll go to a ceremony where there's spiritual healing. Spend time with that. Like I say, and it's not, maybe it's not for everybody, but for those that want to learn more, I always repeat it, you know, you don't learn about surgery on a Zoom, you learn in the operating room. So to advance your knowledge of spiritual practice and ceremony, you have to kind of go into those practices to a higher degree. That's where you learn about that. I'll go to Maya, then maybe I'll try to hit the chat.
Hi, thanks. Thanks again for your lecture and for being here. And I'm work with Dr. Lehman's lab. It's doing research. And my question is, so obviously from your perspective, and I would agree that the ceremony and the container and the psychological emotional work is an enormous part of the healing. And in our system here and with the FDA, which of course under the current administration is a little bit more friendly to psychedelic therapies, but it still seems to really throw people for a loop, that it's a very different model than like the typical pharmaceutical model. And so over the last couple of years, especially since the MDMA got kind of temporarily shot down, there seems to be a movement away from the psychological support and really emphasizing the medicine itself. And so one question for you, is I'd love for you to just address that, but specifically also with your relationship with folks in Australia and other countries, is it similar elsewhere, or is it sort of a particular problem in the US with this perhaps overemphasis on the pharmaceutical product?
Yeah, well, the emphasis on the pharmaceutical product is somebody's
computer this morning, but when I came there to buy something, it wasn't there.
So we got some, I don't know if it's, I think it's Ashley. Hate to mute her. They want to mute her. There you go. Thank you. It's always there, right? I mean, we're in the United States. Like, this is like reductionist capitalism. This is the most in the world. There is no more than here. So as for the answer to that question is, this is number one. This is the place that would sacrifice the children and everything for that more than anywhere else would. So that's one, I think that's fair to say. And so then that's important to say because, okay, that's an extreme. Within that extreme, there's all these forces, you know, trying to push that, and they want to sell their drug or whatever their argument is. Of course, there's a lot of reason to believe that there's more effective ways to do it, and in the case of this psychedelic, where set and setting are known to be such a huge impact. So try to reduce it down to nothing. It's no offense to them, but USONA, I went to their do psilocybin for their clinical trials, and I was participating with them, and they're very open-minded and just exploring these ideas. And they wanted to do a study. They did a study where you had somebody take benzos to try to erase the psychedelic experience, right? So their whole thing is like, can we just do it with a pill and not feel anything, as usual, right? Like, why do you do to make money, right? It's like, can you sell a pill that it makes you feel great, like you went to Las Vegas? It's all, in other words, what is their argument built on? Nothing. Salesmanship. Like, they don't have that product. That product does not exist. But they're telling everybody, well, we're going to get it. And if you give me enough money, I'm sure I can make it for you. So on the way to trying to do that, they said, okay, we're going to put them on benzos to erase the psychedelic experience, to see if you can, then they don't have to be scared, even though the people going through the psilocybin studies at Johns Hopkins and everywhere else, no one's saying, don't stop that part of it. That's not the feedback that's coming from the end of life cancer anxiety study. That's not the feedback that's coming from the MDMA research. So again, it's a salesmanship pitch coming from somewhere that they've convinced somebody that if we can create such a product, we can get really rich. But as far as the clinical reality, that's a question mark. So I just want to like stage it that way. So they erased it with the benzos, and I asked the guy, I'm like, what is this? He's like, well, we're trying to see if we can do it without affecting their consciousness. I'm like, you don't think benzodiazepines affect your consciousness? Like, don't we know that already? Like, isn't that effect? So it's like, yeah, actually, well, yeah, it did interfere with the healing. So it's like, okay, so I'm just saying they pull this argument and try to like make everyone feel like with this big bluff that we're going to blow you away because we've got it, and they don't. So that's my first observation. Secondly, is like, yes, for the research trials, I think there is a reality that it's very expensive to go through the process. And so the MDMA research package, 12-week intervention, which was very effective, is very expensive just to even run the trial. And if they're going to knock you down to go back to the drawing board again, even after you get these pretty impressive results, although it wasn't perfect, it's like, wow, are you going to be able to raise another 20 million or another 50 million to get through the system? So then with the psilocybin research, you see them really reducing the interventions. Part of it's being driven by that reality. So then the question is, once they get through that hoop of getting FDA approved, well, now it's open label treatment again. And people would say, oh, we're just going to only do what they did in the trial. I don't know. I'm a doctor. Like, that's not my practice. I don't know any doctor like that is like, ketamine is, yeah, it's like off label. But are they willing to use it off label? Yes, they are, because the patients need it and it's helpful to them. And it's safe within the parameters. They feel confident and have them sign in a consent form, that said, hey, that this is, they only studied it for this, but we found it helpful for this. So I guess what I'm trying to say is I don't think it's as big of a threat as we think. I think they will try for sure. And the system and the psychiatry and the momentum is going to try to do that. But what's happening meanwhile is whole mushrooms are becoming legalized from their work. And whole mushrooms that people are going to just do on their own, and listen to East Force or develop other practices or whatever they do. So I don't know that I understand the fear around that, but I don't think it's holding it back. I think it's actually opening the door wider. And the decriminalization movement and the legalization movement is driven by the psychedelic research. That's the evidence that's being used to argue that it needs to be legal, that it should be covered by insurance. So those are the kinds of, it's interesting, but it's just like fighting fire with fire. So, that's another side. Maybe that's too hopeful. Maybe that's too optimistic, but I think that's some thoughts I want to share.
Yeah. Thank you for your optimism.
You're welcome.
So A question from the chat. So Dr. Lin was asking about if you had experienced ayahuasca or other psychedelics inducing psychosis. And then I'll follow up that up with another question. How do the people deal with people who come to them for healing who have a history of psychosis? And do you think there might be a role to actually treat psychosis with psychedelics? Because I have heard of a couple people doing that on the underground.
Yeah. Yes, I've seen people become psychotic on ayahuasca. And so I'm not talking about like temporarily, like, okay, yeah, many people having what somebody would call psychosis, like a temporary experience that wears off when the medicine wears off. So I don't, that's, to me, that's something different. But somebody that is like, thrown off their baseline and destabilized for days and needs further intervention. Those people, in my experience, like so far, were people that did have underlying like histories of prior psychosis or prior mania. And so that's the big risk factor. Do you see somebody who doesn't have any history having their first episode that way? I guess you could, and so I don't know if I really ever observed that myself. I did observe a few people deny a history of schizophrenia or something, or prior psychotic episode or manic episode, or known prior history of manic episode that seemed so well controlled that they already did peyote and they did mushrooms and everything was fine. And then ayahuasca pushed them into a serious mania. So I think ayahuasca is definitely one of the more destabilizing substances, but screening appropriately, when you screen out people that have had those histories, and then of course you have to think about if people are really in the process and in the potential to integrate the experience, and how much support do they have to integrate the experience. So there's a lot of factors to take into account, but being careful that way, you can really avoid the problem, And I don't think when we were going through our legal process here in the United States, and you're talking about in Peru, so in Peru, some of the centers do screen, carefully. The old-fashioned way is not as carefully and depends a lot on the honesty of the person coming down there. Back in the old days of the like wild days of Peru, it's just the jungle. So that's up to you. That's how they see it. And the authorities saw it that way as well. If you want to blow your mind like that, well, I don't know. That's a strange thing to do with your life, but that's up to you. That level of personal responsibility is put on the individual in Peru. No one's coming to save you. Like, you have to watch yourself. So that's part of what protects things down there is, life or death and the will to live. So, but the people that are dealing with Westerners and outside of the culture and trying to be more careful and not run into problems, and there's definitely have been major problems that have happened there, major problems, not just medical complications, but people losing their mind and hurting someone else or even killing someone else. So that's the reality of like the Pandora's box, of it. And so that being said, it is very rare. And there are a lot of ways to be very careful to screen and protect against that. In our example here in the United States, like Santo Daime and UDV, the Brazilian churches that are functioning in New Mexico and elsewhere, when we went through our process with the DEA, I mean, you're saying, how many times have you sent somebody to the hospital from Santo Daime or from UDV? 0. How many times have we sent somebody to the hospital from the Church of the Eagle and the Condor? 0. So there is such a way to reduce that harm to the ideal, like that it never happens. And so I think that's the other side of it. So you do need to be very careful. And there is that risk. As far as treating people for psychosis with this, I'm not familiar with that. I would think with ayahuasca, that'd be very high risk. With the other psychedelics, I don't know, like trying to encourage the neuroplasticity to try to like release trauma that might be pushing people's baseline into problem zones. Like, is that possible with something like ketamine when you're already maybe on other antipsychotics or in like, let's say, mood stabilizers, like they're doing, you know, with there are people working with bipolar that way. There is one guy, Benjamin Mudge, who's a researcher who has bipolar and is trying to work with ayahuasca, you know, with his bipolar, and he talks about it and shares about it. I think it's high risk, but there may be a way to do it. But I think you have to have like a lot of safeguards in place to take care of somebody in that type of situation. So then Lynn is asking, what about the native people? How shamans approach psychosis? Yeah, I mean, I think I don't know that I don't know, it's not so common like there. I just haven't run, if I were asked about like because you hear like these people say, oh, the shamans were the schizophrenics, and you hear these anthropologists say things like that. I don't know. I haven't run into like a psychotic Peruvian in the jungle myself. Not yet. So I'm sure it exists, but the shamans that I work with, or they maybe have a couple of screws loose, but still functioning, you know, beyond, not a homeless like person. So in Peru, in the village, if somebody's kind of a little disturbed or mentally unwell to the point where they can't function, they're just like the crazy guy of the village, and everybody takes care of them. You know, there was one, he was pretty harmless, in Yanchama. So that's the kind of thing. It's just a very communal way of helping each other through that range of things. You're not worried about that guy doesn't have to hold down a job or, you know, show up to work. He just does the things that he does there and finds ways to contribute. So I don't know if that's helpful. But when somebody's psychotic, or let's say what we would call, like, well, in the ceremony, if somebody's really, there are ways to try to address it spiritually, energetically. But like in the couple cases that I talked about, where the people did not respond to that treatment, and my teacher was like, Joe, yeah, maybe we should take him to the hospital, which is what we did, you know, like not only twice. So just curious, because I'm wondering if there are other treatments with better side effect than our antipsychotics. Yeah, no, that's a big problem. You know, the psychotics is a big hole in their system, in our system. We don't know exactly. You know, there's Malidoma Somé, African shaman. They claim that their culture had a way to address that. And there was a famous case of somebody that went through a big healing with them, the Dagara people in Burkina Faso. But I think that person still takes medication sometimes. You know, so then there's that side of it too. And so there's some things that they would, beyond the scope of their work. There has to be some other way. Yeah.
We did have a question about epigenetic changes that you saw or that you are aware of. And that might have to be the last question. Let's
sure.
Want to keep going.
Okay. Yeah, we did run an epigenetics study based on, you know, the ideas from the last book, Fellowship of the River. It was this whole visions and things that I got that I was like, oh, it's the epigenetics. Let's focus on the epigenetics. And now, so we did that. You know, we collected saliva samples on the MDMA assisted psychotherapy trial and ran those for not that many because we were interrupted by the COVID. So all of a sudden we couldn't collect saliva, so we only had like 23. So we thought for sure we're not going to be able to find anything with only 23. But then we did. We did find that the focus was around the cortisol receptor, genes around the cortisol receptor, which were known to be disturbed in PTSD. So that's why we were focusing on that. As far as methylation changes on the DNA strand of those regions of the DNA. So this idea of like where is the software? So if there is some degree of genetics, you know, let's say in psychotic, you know, history or bipolar, let's say, yeah, okay, is depression genetic? Is addiction genetic? Okay, maybe there are some genetic contributors, but what about the software? What about the nature versus nurture? Is there a part of the system that we know has some plasticity, and could we activate that plasticity, you know, as an adult? And so then that's what the epigenetics question was, one of those questions. Could you do something like DNA methylation changes? So we did see significant DNA methylation changes that were clinically correlated to the improvement in PTSD. So that was the first study of that kind, and there are other people trying to explore that, but it's slow, and so we haven't seen much else yet. But there are people running related trials and looking at that. And then meanwhile, the software changes that have become maybe more interesting is like the neural network stuff. And so is we can see that we know that these psychedelics are really active on the neural networks. So maybe if it's a problem that's in the neural networks, this would be the kind of thing that would impact that issue. That would be another part of the software and conditioning of the system that we could possibly alter or reconfigure. And so that's another big area to focus on, I think, now. And so I think it's the big link. Just the epigenetic research is really interesting, but it's just such a new field, and it's expensive to run the lab. So we were all excited about it, but very few people are trying to replicate it. And in the case of the MDMA trial, where they had such big results, but it was just a pocket of people, and now they're gone. Trial's over. No more MDMA research like that. Now there's other studies popping up. So that was that. I don't know. Hopefully that answers the question.
Yes, thank you.
Yeah. Well, thank you. I can hang out for a few minutes, Blaine, but if you guys are ready, it's fine too. Maybe that's enough.
Are there any more questions? Otherwise, that might be a good place to stop. And we'll send the invite to the Southwestern folks too, if that was a question for the next talk.
Yeah. Well, thank you, everybody. Thank you, Blaine. Thanks, Larry. Okay. Thanks for the whole team. And please consider taking a look at the new book. I mean, I have the old book, Fellowship of the River, but Medicine Song it's stories. It's trying to be interesting and entertaining, but really trying to illuminate some of these points that we talked about today, and linking it to indigenous prophecy about how can we move forward right now in a world that looks, to some people, there's a lot of problems, looks hopeless. What's the move? Yeah, thank you, Larry.
Yeah, Joe, thanks so much for joining us here. You're a neighbor. We need to get you over here to New Mexico.
I'm ready. Bring me over. Send me over. No, I'd like to go visit. Yeah. All right then.
Cool. All right, folks. Take care.